Hello everyone, welcome to my YouTube channel. This is Dr. Paridhi, your dental mate, sharing with you my simplified versions of dental learning. Removable partial denture of prosthodontics to begin with. And the first topic of the removable partial denture and a very important topic is Kennedy's classification and the Applegates rule. So, the Kennedy's classification, it was given by Dr. Edward Kennedy in 1923, and it is a classification attempting to classify the partially edentulous arches, and 4 different classes of the edentulous arches are given. Okay, the first one is a bilateral edentulous area which is located posterior to the remaining natural tooth. So this is an example of the same. So this is class 1, in which there is a bilateral edentulous area. Okay, both the molars first and second molars of both the sides, that is the right and the left side, have to be replaced. So this is a bilateral edentulous area which is located posterior to the remaining natural tooth. The remaining natural tooth are these, and iske posteriorly is located a bilateral edentulous area. So this is Kennedy's class 1. Kennedy's class 2 is a unilateral edentulous area. Okay, so class 1 is bilateral and class 2 is unilateral, बस यही difference है. So this is bilateral and this is unilateral. So class 2 is unilateral edentulous area located posterior to remaining natural tooth. These both are called as distal extension cases. Next is class 3. So class 3 is what? It is unilateral. Okay, 2 or 3 unilateral. Class 3 is unilateral edentulous area with the natural tooth remaining both anterior and posterior. तो इसमें natural tooth anterior और posteriorly दोनों में present होगा. Okay, so this is class 3. Next, coming on to class 4. Class 4 is what? It is a single area. Okay, see here the bilateral दोनों sides थे, right side and left side, दोनों side edentulous था, but class 4 में it is bilateral area but it is single. So class 4 is what? A single bilateral area which is crossing the midline. So this is the midline and इसको ये cross कर रहा है, crossing the midline edentulous area which is located anterior to the remaining natural teeth. तो ये हो गए 4 classes of the Kennedy's classification which was given by Dr. Edward Kennedy. Now Applegate has given certain rules for the Kennedy's classification ताकि ये अच्छे से imply हो सके in clinical practice. Okay, so what are the Applegates rule? सबसे पहला rule ये है that पहले जितने भी टूथ मोबाइल हो, पेरोडोंटाइटिस हो, ग्रॉसली डिकेड हो, जो भी कारण से एक्सट्रैक्ट करना हो टूथ को, सबसे पहले एक्सट्रैक्शन होगा. सो द फर्स्ट रूल इज द क्लासिफिकेशन शुड फॉलो rather than proceed any extractions. Means classification should follow the extraction. After extraction, the classification must be done of the teeth that might alter the original classification. अब ये फर्स्ट रूल है. एप्लीगेट के टोटल देयर आर 8 रूल्स. ठीक है, एप्लीगेट ने टोटल 8 रूल दिया था. पहला रूल जो है दैट इज फॉर एक्सट्रैक्शन. अब सेकेंड रूल ये है दैट इफ थर्ड मोलर, सी इन दिस केस दिस इज थर्ड मोलर एंड इट इज मिसिंग. सो सेकेंड रूल ये था दैट इफ थर्ड मोलर इज मिसिंग एंड सिंस देखो ये ब्लू है, ब्लू से ड्रॉन है, इट मीन्स इट हैज़ टू बी रिप्लेस्ड. ओके, थर्ड मोलर मिसिंग एंड इट हैज़ टू बी रिप्लेस्ड, तो उसको क्लासिफिकेशन में कंसिडर नहीं करेंगे. इफ थर्ड मोलर इज मिसिंग एंड इट हैज़ टू बी रिप्लेस्ड, इट इज़ नॉट कंसिडर्ड इन क्लासिफिकेशन. ऐसे इफ वी सी देन दिस इज व्हाट? दिस इज अ bilateral edentulous area with natural teeth anterior to it. ऐसे ये bilateral edentulous area तो ये class 1 होगा, but according to Applegates rule, since third molar is missing, has to be replaced, but इसको हम classification में consider नहीं करेंगे. Therefore, this is what? A unilateral edentulous area. सो ये कौन सा क्लास हो जाएगा? दिस इज क्लास 2. Okay, so what is the second rule? If third molar is missing, need to be replaced, it is not considered in classification. Now next rule is what? Here see, third molar is present, but if it is considered as abutment, so इसमें क्या बोल रहा है? इफ़ थर्ड मोलर इज प्रेजेंट, इट हैज़ टू बी यूज्ड एज अबटमेंट, देन इट इज़ कंसिडर्ड इन क्लासिफिकेशन. सो थर्ड मोलर को हम लोग कब कंसिडर करेंगे क्लासिफिकेशन में? व्हेन इट इज़ यूज्ड एज अबटमेंट. इसमें अगर इफ़ इन दिस केस वी आर नॉट यूजिंग थर्ड मोलर एज अबटमेंट, देन दिस वुड बी व्हाट? क्लास 2. बट सिंस थर्ड मोलर इज यूज्ड एज अबटमेंट, so it would be considered in classification and it would become class 3. Class 3, what is class 3? Class 3 is unilateral edentulous area which is present, which has natural tooth both anterior and posterior to it. Okay, next what is it? If the second molar, see in this side, this is the first molar and the second molar is missing, but patient को उसको replace नहीं कराना है. Second molar is missing and it is not to be replaced, so it is not considered in classification. इसमें अब edentulous area it would be unilateral, बस एक हम लोग ये वाला unilateral edentulous area consider करेंगे जिसमें first molar और second molar is being replaced. This unilateral edentulous area would not be considered. Why? Because this side the second molar is not being replaced. So if second molar is missing and not being replaced, it is not considered in classification. So this is unilateral edentulous area with teeth present anterior to it. So this is what? This is class 2. Okay. Now next is what? Next rule, that is the fifth rule. Fifth rule is that जो most posterior edentulous area होगा, that would determine the classification. ठीक है. सो क्या है? एक तो most posterior area जो है वो classification determine करेगा. Next, जो edentulous areas other than the one which is determining the classification, जो other areas होंगे that are known as modification spaces or the modification area, और उनको हम नंबरिंग करते हैं. ठीक है. एंड सेवेंथ रूल क्या है? एक्सटेंट ऑफ मॉडिफिकेशन नहीं देखते कि कितने टूथ मिसिंग है. विल नॉट सी द नंबर ऑफ टीथ मिसिंग, विल सी द नंबर ऑफ एरियाज. ओके. सो इफ वी कंसिडर दिस केस, हियर वी हैव टू रिप्लेस अ मोलर. दिस इज द मोस्ट पोस्टीरियर एरिया. ऐसे देखेंगे तो ये सिंगल, ये क्लास 4 भी हो सकता है, बट सिंस द मोस्ट पोस्टीरियर एरिया वुड डिटरमाइन द क्लासिफिकेशन, सो दिस वुड बी क्लास 3 बिकॉज इट हैज़ नेचुरल टूथ प्रेजेंट एंटीरियर एंड पोस्टीरियर. एंटीरियर और पोस्टीरियरली दोनों नेचुरल टूथ इज प्रेजेंट, सो दिस वुड बी क्लास 3 modification 1. Since there is one single missing space. Okay, now if we consider this case, here there is bilateral edentulous area. Okay, so bilateral edentulous area, most posterior area is the bilateral edentulous area with natural tooth present anterior to it. So this is what? This is class 1. And how many modification spaces are there? 1 and 2. So it has 2 modification spaces. So this is class 2 modification 2. Class 1 modification 2. And the last rule of Applegate is that there can be no modification area in the class 4 arches. Okay, the class 4 arches, what does it say? There is bilateral but single edentulous area crossing the midline. So this cannot have any modification spaces or the modification areas. Okay, so this is it about the Kennedy's classification, which has 4 classes, and the Applegates rule, which were 8 different rules. Now these are 4 questions for you all, A, B, C and D. So comment below in the comment section कि ये कौन से classes हैं, A, B, C and D. So do not forget to like, share and subscribe to my channel. Do hit the bell icon if you don't want to miss the latest updates, and stay tuned, keep visiting.